2 seconds. And we are live.
So hello friends, welcome to Project Pelvis group case discussion number 2. So Jay, is a very interesting case of male infertility.
Okay.
Young chap who's 28-year-old,
Okay.
coming to the OPD with severe OATS, oligoasthenoteratospermia.
Right.
His count is 2.8 million, 5% motility done from a very reliable lab.
2.8 and 5% motility. That's it.
Correct.
Fine.
He's 28, BMI is 27.
Okay. So slightly on the obese side.
Testosterone 627, estrogen is 32,
Okay.
and FSH is 4.2.
Okay.
He does not smoke, does not drink, no recreational drugs.
Right.
Okay. He has been given antioxidants for 1 year, combination of coenzyme Q10, L-arginine, astaxanthin, all those things.
Yeah.
Okay. Also, this chap has been given HMG 150 international units twice a week.
150 international unit HMG twice a week. Injection.
Twice a week. Injection twice a week for 1 month.
For 1 month.
4 IUI cycles done.
At 2.8, nobody told him to do IVF, sir?
Even I was surprised when I saw him first. So 4 IUI cycles done.
Yeah. Self cycles or donor cycles?
Cells. At least it was told cell cycles, I presume.
You were told cell cycles, yeah. Okay.
Okay. 1 IVF self, which is also surprising. And there was a very poor response. Half of the oocytes fertilized, 2 PN was very low. And all arrested on day 2, day 3. Did not have anything beyond that.
Oh my God.
Okay. The wife is 27-year-old.
Right.
Her AMH is 6.2.
Oh God. That's absolutely normal.
She is a normal weight girl.
Yeah.
During stimulation, she was stimulated with HMG 450 and got 18 oocytes.
450.
Yeah. HMG 450, 18 oocytes.
Okay.
And that has not given her embryo. As I told you, all arrested on day 2, day 3.
Oh God.
Okay. So now they've come for a second or third or fourth. I don't know how many opinions. At least to me, it is second opinion.
Yeah.
So what do you feel must have gone wrong? Why has, first and foremost, why was HMG given? 1. And 2, why did IVF fail? Did not form any embryos.
Oh my God. See, I think, if I were to be very honest, at 2.8 million with 5% motility, okay, and you are saying it's a reliable laboratory, so definitely it has been done on a good platform, right?
Yeah.
And on that, if you are giving somebody antioxidants for 1 year, I think that is a disaster. When you are starting with an antioxidant like this, it is an absolute disaster for that patient. Because the sperm counts will only improve typically, the cutoff limit is around 8 to 10 million. If the sperm count, is not in that range and you are giving antioxidants to the patient, there is absolutely no way in which there is going to be any form of improvement as far as the sperm count is concerned. Right? That is the first thing. Second, I strongly think, I'm again very surprised when somebody did 4 IUI cycles in this situation. It is absolutely unindicated to go for IUI at 2.8 million sperms with 5% motility. Absolutely, it has got no role. Okay.
What would be what would be the
again,
cutoff that you
you
look at it? Below what?
No, see the
level?
total. Yeah, see the total motile sperm concentrate at least has to be more than 1 million. So for that you need a sperm count of minimum 6 to 12 million in that situation. And if you don't have a sperm count of 6 to 12 million, you are going to be in trouble. So that is something which you have to understand. You also mentioned on the case I have written down that there is a 150 international units of HMG which has been given to the patient twice. See, honestly and very frankly speaking, giving HMG 150 twice a week, again, absolutely unscientific for a sperm count of 2.8 million. You may try to give HMG 150 in a patient who is having hypogonadotropic hypogonadism, right? But apart from that, in absolutely any other situation, if in case we are trying to give a patient this thing, if in case we are trying to give the patient any form of this type of a combination, it has got no value for this particular patient. All right. And in fact, to be very honest with you, this is going to be more detrimental, because when you give HMG like this, it is going to cut off his FSH even more, and it is going to add more trouble to the patient, honestly. So I think the first thing is you should stop that immediately, right? See, a lot of people are going to ask these questions, that they are interested in knowing something about testosterone to estradiol ratio. I think it has become pretty popular. The most important thing you should understand is, as long as the T by E, testosterone to estradiol ratio, is more than 10:1, okay, no drug will work. No drug will work. That means the body is absolutely normal. The hormonal axis is normal. You can't give a drug to a normal hormonal axis and then expect it to work, because a normal hormonal axis will only become abnormal by your giving more hormones. So 100% it will not work. One more thing I wanted to ask you, sir. 4 IUI cycles were done. I mean, is this guy an educated guy? Does he know?
What I gathered from the history is that he was probably told IVF, but then he just said कि sir अभी नहीं करते हैं, and then
Acha,
the
so maybe because he is young, he wanted to try something types.
yeah, so they said कि, okay fine, let us go up to 4 cycles of IUI. What is the
Correct.
recommended? And after that they said कि, okay fine, now after 4 IUI nothing can be done and you need to go for IVF.
Correct. So basically, they all were on the same page that IUI may not work at all in this case. Correct.
Correct.
Fine. In that one IVF cycle, which failed, basically. Again, I want to know what was, any specific thing, sir? I mean, you said 450 units of HMG was used to get 18 oocytes at an AMH of 6.2. I
Yeah,
mean,
even I would use maybe not more than 300. Actually, I would prefer Rec FSH
yeah,
150. If I'm using HMG 300, what would be your dose?
I would normally give, sir, letrozole 2.5 with HMG 300 combination.
Absolutely,
I would
absolutely,
do that, and
absolutely.
then I would normally go for a dual trigger, because if you are getting 18 oocytes, she is very close to OHSS, so it's lucky that the patient didn't end up with that. But
Yeah.
anyway, when you are saying you have 18 oocytes and no embryo formation, yeah,
No,
I mean,
no, no embryos. All arrested on day 2, day 3, day 4.
all
Day 2,
arrested
day
on day
3.
2, day 3. Yeah, so
Yeah.
there are two things, sir. I think, see, the oocyte factor is virtually eliminated
Hmm.
in this situation. You also mentioned one word. I'm sure you have read this, but you mentioned that word, that there was an abnormal 2PN stage. I mean, the 2PN stage was pretty slow for most of the oocytes, right?
Hmm.
You were
Hmm.
trying to mention something like
Hmm.
that.
Hmm.
So, guys, one thing we have to understand as far as embryology is concerned, as long as there is a fertilization failure, or there is this abnormal 2PN formation, okay, fertilization failure is usually going to be very, very strongly correlating to the sperm factor. Okay. And 2PN stage being abnormal is also going to correlate very, very, very strongly with the sperm factor. Very strongly. Okay. So most probably, sir, it looks that there is some form of severe sperm factor which was involved in this particular situation. Uh Normally, with the type of history which you have mentioned, antioxidants and all these things, 2.8 million sperm count. So what I think, okay, what I think is that they would have done ICSI only, though we are talking as IVF, they would have done ICSI only in this situation. And
ICSI
I
was done.
presume ICSI was done. So I presume the ICSI technique and all these things was absolutely fine. Otherwise, there would be degenerated oocytes. And since we have not got degenerated oocytes, I think the ICSI technique and everything has not been a problem as far as this case is concerned. Right? I would normally, okay, once I get this, see, it's very tough to predict this type of a situation in your first ICSI, okay, because nobody would do that extra preparation for the sperms in order to get, a slightly better quality of embryo in this situation. I would now, like, when the couple has come to you for a second opinion, one thing is for sure, there is no donor sperms in this. They can
No.
easily conceive with their own sperms. There is no donor sperm is out of question. Second, important, sir, that these type of males should consider testicular extraction of sperms. Okay, when a ejaculated sample or a masturbated sample has given rise to a failure, this type of guys should end up considering testicular sperms, because testicular sperms are the ones who are going to be freshly produced. They may have little lesser motility, but their DNA indexation is going to be stronger. So the DNA fragmentation is going to be much, 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 much stronger. Or much lesser, honestly, in a testicular sperm. Okay, and this guy should go ahead with testicular sperms in the next attempt. I strongly think, sir, very strongly think that the history which you have mentioned, I would also like to do a Y chromosome microdeletion at this sperm count. Okay, because this type of abnormal embryo formation is also something where we have to rule out Y chromosome microdeletion in these type of young males. And finally, I mean, just in case when somebody has the facility, I don't know what is the morphological situation of these sperms, but if somebody has the facility, okay, then it is, you have to take a call between doing ICSI or IMSI. Now, see, I have both the situations. I mean, I have ICSI as well as IMSI in my laboratory. And I personally don't think that IMSI is something which gives a I mean, I personally don't think it gives a very major benefit, to be very honest with you. Okay, it is more like a fashion statement and less of any scientific benefit. I think ICSI is also equally good, but I think you need a very good embryologist to look at the sperm selection in this type of situations. And one final thing which I think is important is that in this type of sperms, when we get, especially testicular sperms, the good thing with testicular sperms is you only need incubation and you don't really require any form of separation. But just in case you are doing any form of sperm preparation, then I would recommend to do microfluidic at these counts. Rather than doing our swim up or density gradient or anything, I would recommend to do microfluidic, and I think microfluidic is a good alternative in such type of situations where a previous case has been such that the embryo formation is poor.
Okay. All right. Fine.
Yeah.
So, will you give any medicines to this guy?
No. Nothing will work, sir. Hormonal axis is fine. So nothing is going to work.
Okay. Okay. No Shilajit or any Ayurvedic medicine. You know that those medicines are there.
Actually, sir, Ayurvedic medicines mein Adizova is superb. But
Ah,
it works. It only works when you have 7 to 8, 10 million counts. It doesn't really work at this count. This is severe OAT, sir. Severe oligoasthenoteratozoospermia. Here nothing will work.
you think this chap needs to do weight loss?
If he has the time, then definitely 4, 5, 7, 10 kgs. If he is able to lose, no, it may just benefit in the quality of sperms.
Role of antioxidants?
Does not exist at this counts.
Okay. His varicocele has not been checked. So I
Did
examined
you
him
check?
physically. Yes, I
Yeah.
examined physically. I did not feel anything. It is very difficult to feel the grade 1 and
He
2.
is little obese also, sir. Yeah.
And obese also, yeah. So I asked him to go for a scrotal Doppler.
Yeah.
Now, if the scrotal Doppler shows grade 2 or grade 3 varicocele,
Nothing will work, sir.
nothing will work. Okay,
Varicocele surgery is not going to help. All these coenzyme Q, few, all that will not work, sir, in this case.
okay. His DFI was done. DFI was okay. It was normal.
Oh, DFI was done. It was normal. Wow.
Normal.
Okay.
DFI is
Great.
normal. What do you think about time lapse? Will that help?
You can give an option because see, time lapse is only going to give you a lead as to what is going to happen in the embryo formation. It is not going to enhance embryo formation. It is just going to give you that journey, right? It is not going to help you in anything else. See, like in this case, many people are going to first thing, you know what they'll do to do some time pass. They will give clomiphene citrate. They'll give Clofert. The guy's FSH is 4.2. If the Clofert was going to work, body would have raised the FSH and made it 8, 9, 10 any which ways. So clomiphene citrate and all these types of things is going to have no role in this type of situation. But people will experiment. See, that is the reason why he has undergone so many experimental journeys, such young in life, and now probably by the time he visited you, he must have got totally frustrated, that he has done everything and, something like this has happened. But you know what? Sir, even if we do the best of the things in this case, we should counsel that next time, despite taking testicular sperms, okay, possibility that embryo formation will get arrested again, okay, is going to be approximately 7 to 8%. Huh? So for this, you need to do a very good TISA. Very good TISA.
Okay. Now this girl, no,
Yeah.
her AMH, as I mentioned, was
6.2.
6.2.
Yeah.
And she was not, I mean, she's PCO on ultrasound. She
Okay.
was not given any metformin before stimulation.
Correct.
So I'm going to give her metformin because
It
that
will
is
help.
going to it will help and reduce the chances of OHSS.
Correct.
And at the same time, what my thinking is, if his varicocele comes 3, see, he's only 28,
Yeah.
grade 3 or grade 4, then we've got excellent results with laparoscopic varicocele ligation. You know, a lot
Correct.
of times it helps in reducing the DFI, though this chap's DFI is normal. And
Correct.
more importantly, what we've seen in our clinical practice is that motility increases a lot. Because now this chap, no, he was like, sir, मेरा 4 IUI हुआ है, एक IVF हुआ है, सब fail हुआ है. You guys are saying that same thing can happen the next time as well.
Yeah.
So what is the guarantee I spend so much and I will get embryos?
Correct. Correct. Correct.
So that we've already informed him that, you know, there is no guarantees as such. So we are waiting that varicocele ultrasound scrotal Doppler report. And more importantly, I have told this chap to lose weight, as we discussed.
Yeah. That is,
Yeah,
I think that is important. Yeah.
right, right. Right, so I think that was all that I had. There are a few questions in the group. You want me to take the questions?
You can take any 5 questions, sir. We have already 225 members, so we can't
Yeah.
allow all questions.
So somebody has asked about antioxidant media.
Won't help much. In fact, does not help at all.
Testicular sperm extraction also produces non-motile sperms even after treatment with pentoxifylline.
You don't have to treat them with pentoxifylline. If they are non-metile sperms, but if they are looking good, you can just use laser. The tail will bend. You will know it's a live sperm and you can use that sperm for injecting. No problem.
Okay. If DFI is normal, then what do you think is the cause for day 3 arrest?
It's not day 3 arrest, right? Majority of these embryos are day 1, day 2, PN and all these things. It seems to be a sperm factor in this situation. Absolutely, it seems to be a sperm factor.
And last question, fifth question. When DFI is normal, also testicular sperms used with microfluidics method, why should we tell the patient that there can be a 8 to 10% failure rate, you know?
Yeah, that is because even apart from all these things, even if Y chromosome microdeletion is absent, let's assume, even still you run a risk because of the previous such episode, right? You
Yeah.
are actually currently not taking into account the human error which probably would have occurred. We are currently thinking everything was right. Maybe a change of hands will work very nicely for the patient. But with a
Yeah.
past history of something like this, all right, it is absolutely important to make sure about this, that we give this to the patient in writing, let them take the decision and come back to us, and that is when we should be helping them.
Fine. So summarizing, what we would do is get his weight under control,
That's important.
control the wife's PCOD, no
Yeah.
antioxidants because he's already taking since more than 1 year now.
Yeah.
Okay. IUI 4 done, no role of IUI.
Correct.
We will just await the scrotal Doppler and see what the report comes.
Correct.
And if that is normal, then absolutely ICSI is the only way forward. And we can use MSCS for the sperm sorting, the microfluidic chip for the
Correct.
sperm processing. And explain to the couple that there is a 8 to 10% chance that again a fertilization failure can occur because it
Yeah.
has happened once again in the past. And you know what? He's absolutely not wanting for donor sperms because he's only 28
Okay.
that way. Shilpa
Correct.
madam, your thoughts on the case, please, before we sign off.
Sorry, but I
No, no, no.
really, I didn't hear much, but I feel like, male infertility should be really managed very aggressively because we are seeing so much of this abnormalities in the morphology and motility, and people are doing too much of time waste with the antioxidants. And I think, like we discussed this in our previous fertility classes, where we have clearly told antioxidants will work only if it works in 3 months' time. Otherwise, there is no point in continuing for a very long time. And also DFI is a very important investigation which needs to be incorporated in these kind of cases. And as a whole, the couple should be evaluated and not individualized. And the rest of the things, I think both of you covered it.
Thank you so much.
Yeah. Okay.
So,
Thank
Jay,
you, Sachin.
any last points before you want to end this?
No, I'm little surprised, I'm just still wondering, why 1 year of antioxidants and why 4 IUI cycles? He could have
Yeah.
saved time, He could have probably become pregnant before only.
Yeah, in
Maybe.
that 1 year, they've changed 3 or 4 brands. Basically,
Yeah,
same
yeah.
composition, but
Yeah, but
they-
different brand.
different
No, but
brands.
I think it is because of the pressure from the patients also these days. Like, they want to keep trying and they want to hang on to that myth of not doing this IVF is the best thing, something like that. So they want to keep on changing the doctors, changing the brands, changing from one stream of allopathy to Ayurvedic and all these things. So I think it works both ways.
Sachin
Right.
sir, I'm also wondering in 1 year why he did not come to me for a second opinion. He came to you,
No,
not
because
to
you would have done IVF. That is why he has not come to you.
Yes, yes. No, he had
Yeah.
come, but you were in Bangalore one time, second time you were in
Yeah.
Hyderabad, and third time you were in
No,
Chennai.
he was busy doing the
And
Botox, sir. No, he was busy doing the Botox for vaginismus.
no, and
So
last
they
time
waited and waited and went.
he came for 4 days, but you were in that your holy spiritual journey.
Karnataka.
Chardham,
Yeah,
Chardham.
Chardham.
Yeah.
Yeah, so
Spirituality is working for sure, sir. He has become so silent. It is like, it is killing me that I am feeling very bored now.
okay, guys, thank you so